Thank you, Mike. Okay, well, good morning, everyone, and thank you for attending this webinar. I try to make it as much encompassing and as informational for everyone to understand easily and clearly, so that you're aware of the transitions and things that occur and the options available once you become Medicare eligible. Okay, so next slide. All right. So again, my name is Ish Pina. I'm the Assistant Benefits Manager here at Acera over the medical, dental, and vision and some of these webinar things. And I'm here, I've been here around, it's just over 33 years, providing information and educational items to not just our team members here, but also to members and anyone that reaches out to us. Okay, so during today, we're going to go over some Medicare information, the overview of Medicare, the different parts, Acera and Acera's Medicare mandate. We're also going to talk about Medicare and kind of how it works, and then Medicare plan options that's available. And of course, as always, we're here available for questions, and we'll try and answer as many as we can, and all of them actually, as we go through. And even afterwards, you can always reach out to us and ask any questions as things come up for you. Okay. All right. Next slide. All righty. Okay, so who is eligible for Medicare? Well, generally it's people 65 or older. If you're under 65 and you're disabled, you may qualify to be granted your Medicare early. That would be something that you would have to talk with Social Security about, because they have their own criteria as far as what they deem disabled. So you don't have to necessarily wait till you turn 65 to get your Medicare. If you have a disability, you can contact Social Security, and they'll ask you the necessary questions that they have to see if you fit their criteria, and they may grant you your Medicare early. Okay, which is a good thing, because as you'll see later on when you see the rates, the Medicare plans are much, much lower in premium. Okay, anyone with ESRD or ALS, Lou Gehrig's disease, of course, Social Security Administration oversees a lot of this, and then they leave it over to CMS. So CMS is the Center for Medicare and Medicaid Services. Okay. All right. So if you're currently receiving a Social Security check, then typically your enrollment's automatic, is what Social Security says. But we always encourage everyone to try to reach out to them, and just to check in, make sure that your information is current. They have all your information in case there's any questions or anything in your records that they have. They can go ahead and ask you about it, and you can go ahead and provide updated information. Okay, so Medicare Part B premium will be deducted from either your Social Security check or you'll be billed directly. Okay, so if you're collecting a Social Security check, they automatically enroll you and they send you your Medicare card. Okay, and then the premium for Part B, they go ahead and automatically deduct it out of your Social Security check. If you're one of those that's waiting till a little bit later, a higher age, to collect the Social Security check to receive a larger benefit, then what they do is they'll still enroll you in Medicare. However, they'll bill you directly for the premium. Okay, and they do that quarterly, so they'll bill you for 3 months worth. Okay, your Medicare card will be automatically mailed to you. So when you get that, you always want to make sure you take a good look at it. Finally, a few years ago, they finally stopped sending that out with your full name and your Social Security number on it. Now they've assigned a Medicare ID identification number, which does not look anything like your Social Security number. It's got a bunch of alpha and numbers and letters and so forth. So, which is good, because you don't want to misplace. This happens a lot. People get their Medicare card, they keep it in their wallet or their purse or something. It gets washed, or if you lose your purse or your wallet, now your full name and your Social Security number is floating out there. Who knows who may find it if they do something that's not so nice. So it's good that the card now has an identification number instead of your Social Security number, so they can't just get your information and start opening accounts and doing all kinds of fraudulent things to you. Okay, so some retirees or dependents who are disabled may be eligible for Medicare earlier than age 65, as I mentioned earlier. Okay. Okay, so again, if you're not receiving a Social Security check, okay, it's okay. You want to make sure you contact them you got a 7-month window. So it's the month of birth, 3 months before and 3 months after. Okay, so from the month of that you turn 65, 3 months before, so 90 days before, you can go ahead and give them a call just to check in with them, make sure they have all your information for you to get your Medicare. Okay, now, so most retirees are eligible to enroll in parts A and B at the age 65. Okay, for those eligible at age 65, we encourage you to begin the process, like I said, about 90 days before your 65th birthday. If your birthday falls the first of the month, then your effective date jumps forward a month. Okay, so for example, if you were born, let's say February 1st, then your Medicare would be effective January 1st. If your birthday falls anywhere inside the month, then it's effective the first of that month that you turn 65. Okay, so again, if your birthday falls on the first of the month, then your Medicare becomes not the first of the month you turn 65, but it becomes the first effective the first of the month prior. Okay, so then you can always give Social Security a call at that number there, or you can go on the Medicare website and they have lots of information for you to be able to view. They have a Q&A thing. You can submit a question if you want it directed to them. They have all kinds of PDFs that you can download. A really good book is the Medicare and You. They have it on their website as a PDF. Typically, as you approach age 65, they mail you this booklet to you, but you can go onto their website and download and view the Medicare and You. It'll be Medicare and You 2024. Okay, they always had the year on it so that everyone's aware that, okay, are you looking at the most current book for the current year? Okay. All right, Sarah's Medicare mandate. Okay, so when you or your dependent become eligible for Medicare, which is usually age 65, in order to continue enrollment onto the plan that you're enrolled with us, then you need to transition over to a Medicare plan. Okay, so for the retiree, for you, as you become 65 Medicare eligible, you would need to transition to a Medicare plan. Okay, if you do not transition over, you're not allowed to stay on the regular non-Medicare plan, because now you're eligible for Medicare. You need to transition over. Okay, this mandate applies to retirees who are receiving the monthly medical allowance. So, for example, if you don't do this, you can lose your monthly medical allowance and the coverage. Okay, because we do have to transition you over to a Medicare plan, and you'll see why you need to transition over to a Medicare plan. I mean, it's so much lower in premium, and you'll see those in a few slides. Okay, so currently the Acera offers the Medicare plan. Right now, we only have Kaiser Senior Advantage internally. Okay, for those who do not wish to enroll in Kaiser Senior Advantage plan, you may contact via benefits to get enrolled into an individual Medicare plan that's nationwide. Okay. All right. So Sarah's Medicare mandate, and here's why it's of value to you. Okay. Here I'm using the current 2023 premiums. Okay. So for example, someone that's under age 65, they're on the Kaiser HMO. Okay. Single party. Okay. Single party premium is $909.74. In this example, this person has 17 years of service. So they fall within the 15 to 19 MMA range, which means the Acera would subsidize $462.09 of that $909.74. Okay, so that means out of their monthly benefit check that they get from Acera, $447.65 comes out of their check for them to have that coverage. This same person becomes Medicare eligible. They enroll in the Kaiser Senior Advantage plan. Okay, that current premium is $316.81. Acera is going to subsidize $316.81, leaving their cost at zero, which means that $447.65 gets to stay in your check. So that's a pretty good amount to be able to keep instead of having us take it from you to pay to Kaiser. Okay, so you can see how it is beneficial when you become Medicare eligible to get your Medicare and get onto one of the Medicare plans. Okay, because you're going to save some money there. All right. Okay, next slide. Okay, and in the same way, looking at the price, you saw the premium was $909. If you have a dependent on your plan, okay, The full 909 is coming out of your monthly benefit to have that dependent on the plan. So if your dependent becomes Medicare eligible and they go on to Senior Advantage, instead of you having us deduct that 909 to have your dependent covered, we would only start deducting at 316. Okay, so that's pretty good savings for your dependent to transition over to the Medicare plan on the Senior Advantage and save you some money. Okay, so you can see whether it is a benefit. Okay, so what is Part A? Okay, well, Part A, it basically covers a hospital insurance. It's the hospital portion of the Medicare. Okay, it pays for hospital stays, nursing facilities, rehab, long-term care, hospice care, things like that. Okay, so typically, the vast majority of us, if you've worked enough quarters, okay, you don't have to pay for Part A. It's basically free, okay, because you paid in while you were working. Okay, so for those who are told that they do have a premium for the Part A because they may not have worked enough quarters, okay, there is a way where you can, if you're going to elect to stay on Kaiser, you can elect to waive the Part A and just get the Part B and still be able to get onto the Senior Advantage plan. Okay, and I'm going to go over that in a few slides. Okay, so here, Medicare Part A. Again, this is the 2023 figures. Okay, so for majority of Medicare Part A, costs nothing because you, your ex-spouse, married for 10 years, paid Medicare taxes, and so you qualify. So, for example, quarters, 40 plus quarters, free, no Part A. Okay, if you didn't work and pay in the full 40, then there is a slight premium. As you see, 30 to 39, they're going to charge you $274 a month. Of course, if you have zero, you didn't pay ever in at all, then they charge $506 to have the Part A per month in 2023. For 2024, that's actually gone down. That's gone down to, I believe, 504. Okay, so it went down like $2. So, but they would still try to charge you for that Part A. Okay, so again, it all depends upon how many quarters you've worked. In most cases, if you choose to buy Part A, you must also have Part B, and of course, you would want to have Part B. If you're going over to individual plans, like for example, if you're going to go over to via benefits for an individual plan because you don't want to be on our Kaiser Senior Advantage plan, you will be required to have both Parts A and Parts B. Okay, the individual carriers, they require anyone that's age 65 or older to have Medicare Part A and B. Okay, otherwise chances are then they won't. They're not going to enroll you into a plan. Okay, so again, there is a late enrollment penalty if you don't enroll into it when you first become eligible. Okay, so and of course you'll end up having to pay a higher premium twice the number of years you could have had Part A if you didn't sign up for it originally. Okay, so that premium, that penalty stays on there for just a little bit, but then it'll eventually drop off. But they do charge you a penalty if you don't sign up for Part A when you first become eligible for it. Okay. Now, Medicare Part B. This is the medical insurance portion of Medicare. Okay, it helps pay for all the Medicare approved doctor services, outpatient, preventive care services, diagnostic tests, all those types of things. Okay, everybody pays for Part B premium. Everybody. There is no free Part B. Okay, so for most Medicare eligible individuals, the monthly premium in 2023, the base amount for Part B was $164.90. Okay, that's the lowest standard monthly Medicare Part B premium amount that was charged in this year in 2023. Okay, and again, this is usually deducted out of your Social Security check if you're collecting a Social Security check. Otherwise, you'll get a bill quarterly for 3 months worth. So $164.90 times 3, you'll get that quarterly bill. And that is something you need to go ahead and make sure that you pay, because if you do not pay Medicare their premium, they will disenroll you. And then you have to start the whole process over about trying to reapply and so forth. Of course, when you sign up for a plan, for example, your plan is Medicare is assigned to that plan and that carrier. If anything disrupts your Medicare enrollment, Medicare automatically notifies that carrier that, hey, this person has lost their Medicare. And of course, that carrier is going to turn around and terminate your coverage. And you don't want to do that. You don't want to lose your coverage. So you want to make sure you're staying on top of making sure your premiums are being paid. Okay. So it does take care of, preventive care supplies, all kinds of things. If you want to try and go through and see what exactly it covers, you can go to Medicare.gov and you look up what it covers, and it gives you a long list of stuff that they cover. Okay, that's covered under it. Okay, so enrolling in Medicare Parts A and B. Okay, again, you can apply online through Social Security. You can give them a call. You can visit the Social Security office. If you do decide that you want to walk in and have a face-to-face with the representative at Social Security to enroll, I highly recommend that you contact them and make an appointment. Because if you've ever been to the DMV, you might be sitting there for a little while with that little number in your hand, watching for your number to be called. Okay. So from what I understand from members, when they make an appointment with a representative face-to-face of Social Security and they arrive for their appointment, they're seen within minutes. It's not a long wait like it used to be. Okay. They've gotten much better. Okay. Again, fill out an application for enrollment in Medicare Part B, submit it in person to any Social Security office, or you can mail it to the nearest office, Social Security office. Okay. Now, keep this in mind. Completing the application form and submitting it does not automatically enroll you in Part B. Social Security must first determine if you are eligible to enroll. So they're going to check to see if you've put in the quarters and so forth, and then they also do a 2-year look back as far as to determine what premium they're going to charge you for your Part B, and that's coming up in a slide. So, okay, here's the 7-month window I was speaking of. Okay, so basically it's 3 months before your 65th birthday. Okay, the birth month that you were born, and 3 months after. Now, if you were born on the first of the month, if your birthday falls on the first, then your Medicare eligibility starts effective the month before. Okay, so if you're born, let's say February 1st, then your Medicare eligibility won't be February 1st, it'll be January 1st. Everything moves up a month. Okay, so just keep that in mind. Now, Social Security does have a enrollment period if you miss your initial enrollment period. Okay, so January through March each year, they have this special enrollment period. Okay, coverage begins effective July 1st of that year. So if you missed your time to enroll and during January through March, you went to apply to try to get it, they're not going to get activated right away. They would grant it to you July 1st of the year. Okay, now there is a lifetime, and I repeat again, lifetime 10% penalty for each 12-month period that you didn't enroll into the Part B. Okay, so the only exceptions is if you're working aged. Okay, what they mean by that is if you're still working, okay, and you're on an employer group plan, okay, or with with an employer somewhere, okay, or you're under your spouse's employer plan because they're still working, okay, then as long as you're on an employer plan, you don't have to enroll in the Part B. You can waive that because you're on an employer plan. And the reason why you'd want to do that is because, remember, see, you're going to have Part B costs you a premium. Okay. And if you're on an employer plan, Medicare is going to look at that employer plan as primary and most employer plans cover everything 100%. So you'll be paying Medicare for the Part B premium, and they're not going to pay anything because they're going to say, okay, the employer plan is primary. So you have to take your bill for your services to them. Okay. So why give away the free money, right? So if you're on an employer plan, whether it's one that you're enrolled in because you're working still, or you're on your spouse's or dependent's medical plan, you want to make sure you let Social Security know that you're going to waive the Part B because you still have coverage under an employer plan. That way, when the time comes, you won't be assessed a penalty. Okay. All right. And again, here is about the employer plans. So you could delay enrollment in Part B and just use the employer plan. Okay, you can enroll in Medicare Parts A and B and have both Medicare and the employer coverage. Like I said, there's likely no benefit to that because they're already going to say the employer plan is primary. Okay, and plus during that time you'll still be paying for that Part B premium. Or you can reject the employer plan, enroll in Medicare, and then supplement other ways. That's usually not a good option because being on an employer plan is usually the richest plan you can get. Okay, so of course you'd want to stay on that, and then eventually when you come off the plan, then contact Social Security and say, okay, I'm not going to be on this plan anymore. Now I need my Medicare, and then they can go ahead and grant it to you. Okay. Mike, is there a question? I see a red one on the bottom.
There is. So the question is, so Part B is necessary even if still employed with Alameda County or only once retired?
Okay. So once you're retired, if you're employed and you're on an employer plan, you can waive the B. That way you don't have to pay that monthly premium for the Part B. Because like I said, the Medicare is going to see, they see that if you're on an employer plan, they're going to say, okay, you're at that employer plan's primary. We're not going to pay any of these bills. You got to take that to that employer plan. So, if you're on an employer plan, you can waive the enrollment in the Part B until you come off that employer plan and then get your Medicare Part B. Okay. A is free, so you can still, you're not paying anything for it. So you can still go ahead and get that. If it's free for you, go ahead and get that and just waive the B until you come off that plan. Okay. All right.
Yeah.
Okay. So again, here's a way to kind of know what it is that they're going to try to charge you for their the Part B. Okay. And mind you, Medicare, they always do a 2-year look back. Okay. So right now in 2023, they're looking back at 2021 tax returns. So depending upon what you provided to the IRS as far as your income in 2021 and where it falls in this chart is going to determine where you fall for your premium. Okay, so for example, in the first row, file individual tax return $97,000 or less, file joint tax return $194,000 or less. You scroll across, you see the base amount of $164.90. Okay, we can skip down to like the fourth one, above 153,000 up to 183,000. Or filed joint return above 306,000 up to $366,000. Slide that across. Your premium for the Part B is $428.60. Okay, so depending upon where you're falling on this chart, that's what's going to determine by Social Security or Medicare. They're going to say, okay, this is what you're going to have to pay for your Medicare Part B. Okay, now this is the amount for the current benefit year 2023. They did release the new chart for 2024, and so the cost did bump up just a little bit. So that base amount of the 164.90 for the lowest average amount for the Medicare Part B, that is now going up to 174.70. Okay, so 174.70 is what the base amount is going to increase to come January 1st. Okay. All right. Next slide. Okay. Now here's the thing. Now you say, "Oh God, that's going to cost me that 164.90." Well, for the retiree member, and this is only for the retiree member, not for dependents. Okay. So for the retiree member, as long as you have at least 10 years of service or a service-connected disability, okay, you can qualify this Medicare Part B reimbursement plan program that ACERA offers. Okay, and what it is you get your Medicare, you complete the MBRP form, okay, that we have, and you complete that. It's a real simple form, name and address, just mark that you got your Medicare, sign the form, and send that back to ACERA, okay, and you can do that electronically if you like, and provide us a copy of your Medicare card that shows that you have Part B. And in your retirement benefit every month, if you ever look at your statement And you notice on the, let me take a look at it. Okay, visually, okay, so on the left side, the top box, you'll see your base amount, and then you see your cost of living. Okay, you'll see a new line that says Medicare Part B reimbursement plan, and then you would see that credit of the 164.90. Okay, so Social Security, Medicare takes the 164.90 out of your Social Security check. Okay, but here at your Acera check, we're giving you a credit of 164.90. So basically, they're taking it from you over there, but over here, we're giving you a credit to offset that. Okay, we're not paying the Part B premium for you. Okay, we're giving you a credit of what you paid to them to have it. Okay, don't make the mistake. We've had some members who, for whatever reason, thought that Acera, by signing up for this Medicare Part B reimbursement plan, that Acera is sending the 164.90 to Medicare, and so they don't pay the Medicare premium. Well, that's not what it is. You are responsible for making sure that 164.90 is paid to Medicare, whether they're taken out of your Social Security check or whether you're sending in that quarterly bill for the 164.90. But in your retirement check, we're giving you a credit every month of that 164.90. Okay. Well, in December, because Medicare just released what the new premium is going to be, which is that 174.90, the base amount. In December, we're going to be taking it to our board of retirement and having them authorize to approve for us to increase the 164.90 that we currently pay up to the match that 174.70. So in December board meeting, we'll be presenting that to get approval, and then that way, come January 2024, for those who enroll into this plan to get this credit, you'll see that 174.70. Okay, going in January. Okay, so again, it's not a matter of whether or not you are enrolled into an Acera plan. Okay, this is a years of service benefit. It's totally separate than from the medical plans. Okay, this is a years of service benefit. So you can be still eligible to receive this, even though you're enrolled in a medical plan through another employer, through your dependent's employer plan, wherever it is else, other than being enrolled in a Acera plan, you can still get this benefit. Okay, you can get this credit. Okay, so again, you just got to make sure you enroll in the Medicare Part B, complete our form here, and provide us a copy of the Medicare card that shows you have Part B, and then our team can activate that into the benefit pay system to pay you that. Mind you, this is not a retroactive benefit, so you got to make sure you're watching for that Medicare card to arrive and provide that to us so that we have your form and the card so that our team can see that we have everything we need from you so that we can activate this credit onto your monthly benefit. Okay, if you forget to send us the form or the card, and now you remember, oh, 2 or 3 months down the line, oh, I got to get this in, and you send it in, we're not going to go retro back and pay you for the months that had already passed. It's from we get everything from you completed as is. Okay, so it's not a retroactive benefit. So keep that in mind. And unfortunately, it's not an automatic enrollment. Okay, you may be in Medicare and be in a Medicare plan. That's great. You're saving some money on premiums, but this is totally separate than the medical plans. This is a years of service benefit. So to be eligible to get this, you need to complete the form and send it in with the Medicare card. Okay, it's totally separate. Okay, and again, enrollment in a Acera medical plan is not required for this. Okay. There's 2 questions I see, Mike.
Okay, sorry about that.
Sure.
Okay, question number 1. Will the payment be adjusted as your income changes?
No, this is not like your income that you get from us that that every year you get a cost of living and your benefit increases. This is a set premium that Medicare sets every year. So this 164.90 is the base amount for the whole year of 2023. Just like in 2024, the base amount is 174.70. Now, as far as if your question is if you're being charged higher than the base amount, okay, then yes, that can adjust because, for example, and this has happened, and it does happen, where let's say 2 years ago in 2021, let's say that just happens to be the year that you got a lot of money out of an IRA account, okay, or you sold some property, or you got an inheritance because something occurred, and so of course all that's income. You got to report that on your taxes. So for that particular year, it looks like your income is very high, and so when Social Security, Medicare looks at your IRS stuff and they say, "Oh, this person's making pretty hefty amount. We're gonna have to charge them this amount." Okay, well, yeah. So then that was just that one-time item, right? So the next year, yeah, you can always definitely they'll see what your IRS reporting is, and they'll see that it's actually back down to lower, and then they'll go ahead and adjust what they're charging you. If they don't lower it down, then you definitely want to reach out to them, say, hey, you were charging me a higher premium because on that particular tax year, I sold some property and my income looked higher, but it's not high. That was just that one-time thing. So my income's down lower now. So, and they're usually pretty good. They'll take a look and say, okay, yeah, we apologize for that. Let's go ahead and adjust this and get you down where you should be. So yeah, they do adjust. Yes, they do. What's the other question, Mike?
Okay, next question. Do you have to apply for Sarah's Medicare Part B reimbursement plan each and every year or just once initially? And when you do, uh, is will it transition smoothly?
Okay, that's a good question. And so no, you only have to apply it one time, okay? Because once you're granted your Medicare, you got it. You're not gonna It's not gonna stop unless you for some reason stop paying Medicare their premium that they're asking for, and then they're going to disenroll you. So you get your Medicare, you apply for this MBRP reimbursement plan, we activate it, it's done. You're going to keep getting it every year. You don't have to keep sending in a form. And then every year, whenever Medicare updates their amount, for example, this year they're going from 164.90, they're going to increase it to next year to 174. So you being enrolled, that's why we go to our board and say, hey, for next year, Medicare is increasing the amount. We want to increase the amount. They'll approve it, and then you'll automatically see that increase in this for the new benefit year. So you don't have to reapply every year. There are times where we may do an audit because there are some members in the past who, for whatever reason, dropped their Medicare and did not notify us that they had dropped their Medicare, and so they weren't paying Medicare, but yet they got this. They were still getting this reimbursement for a few months. Okay, so so that's why every so often, and it's at random, you never know. But if you did get an audit letter from us, it would say, hey, this is an audit. Can making sure that you're still enrolled in Medicare, provide us a copy of your Medicare card or the copy of the Social Security letter that they send you at the beginning of the year, notifying you that you are still enrolled. And then, and then boom, you just check it off. Boom, yep, this person's still enrolled. Done deal. So, but no, you don't have to reapply every year. It's one and done. You're in. The only time you ever have to reapply is if, for example, you did drop your Medicare for whatever reason, you missed a premium payment and Medicare dropped you from your Medicare. Okay, and then of course, if you're on Kaiser, they notify the carrier. So Kaiser would provide us a report, say, hey, this person is disenrolled according to Medicare. So then what would happen is, because we will start to reach out to you because we need to know, are you getting this fixed? Because if you're not, then we are going to terminate your plan, and you can't be on our plan if you don't reinstate your stuff. And so at that point, you would go back to Medicare, talk with them, say, oh yes, my apologies, I was on vacation, forgot to send you the premium. And normally the Medicare pretty much works with you. So if you did that, we have some members who have done that in the past. They've gone on a cruise for a long time or whatever, missed making a payment. Medicare dropped them. They contacted Medicare, made up the payment. And usually if you make up the payment to catch you up, Medicare goes ahead and reinstates you retroactive with no lapse. Okay. Now, if they did provide you with the lapse, it's okay. Well, we understand that, but we're not going to start it again until such and such month, then of course for those particular months you're not going to get the reimbursement. And then at the time when that you do get it back on, you want to make sure that you supply us with a form and the letter that shows it's been reinstated back on again with the new date of what your Medicare is effective. Okay. All right.
Okay, that's it.
All right. Okay. Now, Medicare Part D. Now, Part D is the prescription portion of Medicare. It covers the prescriptions. Okay. Now, most Medicare Advantage plans, and we'll talk about the differences of the Medicare Advantage plan, but if you're enrolled into a Medicare plan, such as, for example, our Kaiser Senior Advantage, Medicare Advantage plans it has a prescription portion to it. Okay. So it has Part D built into it already. Okay. And typically, the carrier plans that have a pharmacy component to it is better than just having straight Part D prescription. Okay. So as long as you're into a plan and you got a prescription drug plan, you're good to go. If you are over a certain dollar amount and you can take, and this is kind of, I mean, I never did like when they started this several years ago. But for example, if you look at the chart, the first row, if you're filing 97,000 or less, joint 194,000 or less, and this is for 2023, okay, it's just whatever your plan premium was. You're just paying your medical plan. If your income reporting to the IRS is 97,000 up to 123,000 or 194 up to 246,000, if you're filing joint, then it's 1220 is what you're going to have to pay. So basically it's called an IRMA. Okay. It's an income related monthly adjustment. And it's not so much that you're paying a premium to have the Part D with Medicare. No, this is an adjustment because you have a higher income. It's kind of like, to me, it's kind of like penalizing you. Why am I being penalized? Because I have a nice benefit coming to me every month. So in any case, they do charge an IRMA, and it's a separate bill. Okay. And so you got to make sure you pay that IRMA if you fall into that category, because if you don't pay the IRMA, it's all connected. If you don't pay the IRMA, then what they do is they disenroll you from the Part B and the Part A. You get disenrolled from Part B and Part A. What happens? Your carrier is notified. Your carrier is notified you no longer have Medicare. What do? They're going to drop your coverage. So you want to make sure you stay on top of any of these that you billings and so forth that you get from Medicare, and make sure it's all taken care of and paid. Okay. All right. So these are the types of Medicare plans. Okay. You have your Medicare Advantage plans. Okay. Those are the ones where you actually have a primary doctor. Okay. Kind of like now, if you're on an HMO or something, you have a primary doctor that you go to. Okay. And basically on a Medicare Advantage plan, you have your primary doctor, you're in with this plan, and basically you're telling Medicare, okay, hey, this is the plan I'm going to because my primary doctor's here. So your Medicare gets assigned to that carrier. So every month, and this kind of explains why you get, as you approach age 65, why you get truckloads of junk mail, and everybody wants you to sign up with them, right? Offering you, gym shoes, gym bags, binoculars, whatever, sweatshirt, because, for you to sign up with them, because they want you to sign up with them, because as long as your Medicare is assigned to them, whether you go to the doctor this month or next month, doesn't matter. That carrier is still getting paid. They get a stipend from Medicare. Okay. So for those who like, oh, I'm not feeling well, but I'm not going to go to the doctor, I'll just take some medication. Okay. They love you because you have the coverage, but you're not coming in and using it, which means they're getting paid money regardless, not just you paying your premium, but they're getting paid also from Medicare. Okay. And they're not having to pay for any services because you're not going to the doctor. So, for those who don't want to go to the doctor when you should, go to have things checked out, oh, they're loving you. Okay. So again, on a Medicare Advantage plan, you must get your primary MD to give you a referral if you need to go see a specialist. Okay. Most of those plans, like I mentioned, it has prescription coverage, and Part D is built into the plan. Yeah, you may or may not have a copay. Some of those plans have no copays, some do. And you must reside in the plan service area of that carrier. Okay. So that's the Medicare Advantage plans. The supplement plan, or also known as the Medigap plans, those Medicare is not assigned, your Medicare is not assigned to the carrier. You still have power over you with your Medicare. You can go see any doctor, any specialist, go to any facility nationwide that takes Medicare. Okay. You don't have a primary physician. You may have someone that you'd like to go to, okay, and they may take Medicare, but it doesn't mean that they're your primary listed as your primary MD. Okay. So again, you can go see any MD that accepts Medicare nationwide. Okay. No referrals needed to go see a specialist. You can see any specialist nationwide as long as they accept Medicare. Okay. These are medical only. So there is no prescription drug plan component to the supplement plans. Okay. So when you sign up for a supplement plan, you will need to submit and sign up for a prescription Part D plan. Okay. Copays and deductibles can vary depending upon the plan you select. And again, this is the United States, the entire United States is the service area. Okay, those are the supplemental plans. And then you have the Medicare Advantage plans. Okay, so if you're one of those members that, likes to go stay with the family in another state somewhere for a few months, or you like to go stay in your, a nice warm area following the warm weather, and then for a few months, and then later on come on back. Supplemental plans is big time for those members that like to travel a lot, or who stay elsewhere for different periods of time. Okay. Medicare Advantage plans are I see typically are members who are pretty much stay within the area here. They don't go traveling far for long periods of time, months at a time. They pretty much usually stay here. Okay. All right. All right. So the plans that Acera offers. Okay. We have on the non-Medicare plans for general use under 65, we have Kaiser HMO. We have United Healthcare Signature Value HMO, and we have United Healthcare Signature Value Advantage HMO. Okay, those are all non-Medicare plans. On any of those plans, if you're enrolled in one of our plans and you become Medicare eligible, you would need to transition over to a Medicare plan. So you have the Kaiser Senior Advantage plan, okay, and then you have Via Benefits. Via Benefits isn't a carrier; it's not an insurance plan. They're more like a broker. Okay, so you can contact them, and they have their databases, and they'll ask you all the questions that's typically on an enrollment form: your name, address, what medications you have, this and this. That way they can see, okay, this is where you reside. These are the plans available in your area. Which of these would you like to enroll into? Okay, and they also have a really good team that can assist you to enroll into that plan. Okay, and they'll also be able to help activate the HRA account, the health reimbursement accounts. Okay, because as long as you're on an Acera plan, which is the Kaiser Senior Advantage plan, is an Acera plan, on your monthly benefit you'll see the deduction, Kaiser's Permanente Senior Advantage, but then you also see the subsidy, Kaiser's Senior Advantage Acera MMA subsidy, and where we're offsetting the premium. When you come off of our plan and you move over to Via Benefits, those aren't Acera plans. Those are individual plans. You would be responsible for paying the premium directly to the carrier that you get signed up with. Okay. And then you would get reimbursed through the health reimbursement account from Via. Okay. So you wouldn't see that plan on your monthly benefit statement from Acera. Okay. And I'm going to go over that a little bit further in. Okay. So this is the new 2024 premium for Senior Advantage. Okay, so if you are going on Senior Advantage, okay, typically it says, if you get the A and B, you want to get the A and B. Okay, you get your A and B. This is only for California residents. Yes, there is Kaiser in other states. Okay, however, our contract is with California Kaiser. Okay, so Self by yourself for 2024, it's going to be 354.31, and then depending upon the years of service you have, the MMA would cover a good portion of that, if not all of it. Okay. Self plus one, if you and your dependent are both Medicare, 708.62, and then of course we're subsidizing the MMA towards your half, and those are the family premiums there. On the Kaiser Senior Advantage plan, our premium, our copays are $10. Okay, office visits, allergy treatments, exams, things like that, $10 copay. So just from the HMO down to the KIPSA, you're saving $5 a pop, because if you're on a lot of medications and you're on the HMO, you're paying $15 a pop for the copays, right? On the Senior Advantage, that drops down to $10. Okay. With this benefit available still for 2024, we have the Silver and Fit gym membership. Okay, so you can contact Silver and Fit and get into a gym. They have thousands of gyms throughout the Bay Area for you to be able to go and exercise and get in shape. You can utilize whatever facilities they have. Some have all kinds of stuff, spas and swimming pools and all kinds of classes and stuff like that. So whatever is offered at that gym that you sign up for. Okay. So, Sarah, we do require retirees and dependents to be enrolled in Medicare A and B upon the eligibility of turning 65 so that they can be transitioned over. Okay. Okay. Now, we do have a Part B only plan, okay, if that's applicable. So we have some members, and usually it's members who have never paid into the system. So what happens is if you're one of those members that's being told, okay, hey, you've never paid in, you're gonna have to have a premium for Part A. You're gonna have to pay that $504 for it every month, and then you're also going to pay the premium for Part B. Well, you can waive, as long as you're going to go on our Kaiser plan, you can waive the Part A. Okay, so you don't have to pay that $506, $504, whatever it's going to be, and just get the Part B, and then you can still get onto the Kaiser Senior Advantage plan. Okay. However, if you're eligible for both A and B, we recommend you get the both A and B. But if you're being charged at $500 and something for the Part A, you can waive it, just get the B, and you can still enroll into this plan. Okay. If you ever contact Social Security when you go and you're being told that you're going to be charged at $500, this and this, go ahead. You can go ahead and give us a call, and we can talk with you and kind of explain what you need to do. But basically, you'd want to waive the A, just get the B. Okay. Now there's a word of caution. Okay. Sarah, because of our negotiation and relationship with Kaiser granted us this Part B only plan. Okay. So we're the only ones that's going to have this. So if you don't have Part A, but you have Part B, and you try to leave our Kaiser plan, right, and go somewhere else, you're going to have to get the Part A, because other plans, carriers, they require both A and B. Okay. So just a word of caution on that. Keep that in mind if you ever decide to, leave our Kaiser Senior Advantage plan once you get in it. You're going to need both A and B to get into another plan. Okay. Yeah. Is that a new question, Mike?
There is. It's back to the IRMA. Does the IRMA, the earnings, the adjustment for the Part D pharmacy penalty apply to Kaiser Senior Advantage program, which includes Part D coverage?
Well, it's not so much about the plan. The IRMA, that Part D IRMA, that's something totally separate compared to what plan you're on. That is just something that Medicare charges because from your IRS reporting, they're seeing that your income is pretty high, so they ask for this adjustment. They want you to pay a little extra to them directly for just because you making pretty good money. That's why I said it's almost like being punished for having a good benefit. So yeah, it has nothing to do about what plan you're enrolled in and so forth. It's something totally separate. Okay.
And then there's a second question. What if you move out of state where there's another Kaiser location available.
Okay. So if you happen to relocate, if you're in a Kaiser and you happen to relocate out of state to where there's another Kaiser, okay, like, and they have them all over. They have them, they're in Oregon, Washington, Hawaii, Georgia, Colorado, Boulder, Colorado. They're in other states. So if you happen to relocate from here and go to another state where there is a Kaiser, what you'd want to do is you'd want to contact that Kaiser directly and confirm that where you're now residing, is it in their service area? If it's in their service area, then you can go ahead and enroll directly with them in an individual Kaiser plan. Once you have enrolled in that individual plan, then you want to contact via benefits and let them know, hey, I'm an ACERA retiree. I'm enrolled in Kaiser over here in Georgia or Hawaii or whatever the case is. Okay. And then via benefits will check their records to see that and be able to confirm that, yes, you are an ACERA retiree member. And then they can go ahead and activate your health reimbursement account. Okay. So basically, you'd be enrolled in an individual plan out there, individual Kaiser plan. You pay the premiums to Kaiser, and then you'd want to contact via benefits so that you can get reimbursed for what you paid for your premiums. Okay. Through the health reimbursement account, you're able to get reimbursed not just your premiums, but also your copays. Okay. So you're paying your monthly premium for that plan. Now the doctor says, oh, you need this and this and this. That'll help you this and this. You go to the pharmacy and you buy a couple of prescriptions. Okay. Make sure you hold on to your receipt and you complete the claim form, copies of whatever documentation, the receipt, and so forth, and get that into via benefits. And via benefits will take a look at the health reimbursement account. They see that you have a balance available. Then they're able to reimburse you for not just your copays, but also your premiums and so forth through the health reimbursement account for those that are enrolled on the outside plans. Okay. And I think
Okay.
I'm going to be going over that in just a little bit in a few slides.
And then one more question. Does Medicare send you a separate bill for the IRMA, or is it all included in the regular bill with the rest of the Part D or Part B charge?
I believe it's a separate bill. If they do put it on one bill, because they've been changing a lot of stuff, that the way they do things over there. If they do put it on the same bill, it'll be a line item. You'll see it. It'll say, Part D IRMA. It'll say IRMA, and then it'll have that whatever figure it is. But I believe it is a separate bill. Okay.
Okay. All right.
All right. Yeah. Silver and Fit. Again, this is, there's no cost for the membership. They've got over 14,000 different gyms participating. Once you sign up, they can send you a home kit so you can work out at home. All right. Or you still be able to go to the gym. So you can go to the gym that you want to go to. That's a participant with the Silver and Fit. And it says but they can send you both. You can still go to the gym, and then they can also send you a home kit. So at home, while you're home, like pretty soon the weather's going to start getting burst cold. You don't want to go outside. You want to work out at home. You can turn on the workout videos that they got on demand and do your little workout and make sure you're staying in shape. Okay, so they have lots of good benefits on that. That's on the Senior Advantage plan. Okay, all right. So, Sarah's United Healthcare plans. Okay, so not everybody's on Kaiser. We have members who are on United Healthcare. Okay, so we do not have a Medicare plan with United Healthcare. Okay, so with United Healthcare, we don't have a Medicare plan, and so what you would do is if you don't want to come over to Kaiser Senior Advantage, then you can contact via benefits and they can assist you to enroll into a Medicare plan. Okay. United Healthcare, they do have Medicare plans available. Via benefits can assist you to locate one of those. We have members who do that all the time. They're not always called United Healthcare. For example, United Healthcare is a very, very large corporation. Okay. So a lot of medical plans, names that are familiar, you may find familiar, are actually owned by United Healthcare. So if you ever get a document for like say from Secure Horizons, Okay. If you ever look at it, you see it towards the very bottom, a little small print say a United Healthcare subsidiary, right? So they own quite a few plans. They own Pacific Care, they own Secure Rises, they own a whole bunch of them. So if you can contact via benefits. When you do, you want to make sure you have your name of your doctor, all the prescriptions that you're on. Okay, that way they can assist you to find a plan. That way you can continue seeing your doctors and so forth. And most doctors do take Medicare. You can always check with your doctor's office to make sure that they do accept Medicare. And you can check with them as far as which plans they tend to do business with. They may tend to do the Blue Cross plan or an Aetna plan or something like that. So you can always check with your doctor's office as far as the Medicare. Do they accept Medicare? And which plans do they typically use? And you can go ahead and contact via benefits and get into a plan. Okay. So once you enroll into a plan over there with via benefits, they would also activate your health reimbursement account, so then you can get reimbursed for your premiums and your copays, okay, through the health reimbursement account. So again, to continue eligibility for Acera's monthly medical subsidy, the retiree members have the following options. You can enroll in Sky Senior Advantage plan or contact via benefits and enroll in a Medicare plan to qualify for that reimbursement, which is funded. And they never have the money. Some members get upset and say, well, I didn't use all the money that was in there this year. Via benefits kept the money. No, they never. Via benefits never has the money. The money is always here in a Acera account. Okay, they just, whenever you submit a claim for something, then they reach out and they say, okay, hey, we have to reimburse $200 to this member, and then they're able to draw from that account and provide you back your reimbursement. So they never keep the money. Okay, so you're always good. And the money, if whatever you don't use that's in the account, just reverts right back into the Acera Giant Fund. Okay, and we're going to talk about that in just, I think, another slide coming up here. Let's see. Okay, via benefits Medicare plans. Okay, so plans through the Medicare exchange are not Acera group plans. Okay, they are individual plans and will not appear on your monthly statement from Acera. So just want to make sure you understand that. Okay, members and independents are solely responsible to pay any premium to those carriers to maintain that coverage. Members who are eligible for the medical allowance will be granted the health reimbursement account for their out-of-pocket expenses for medical stuff, up to the qualified amount. There is a total amount, annual amount that goes in there. So you're able to go ahead and submit reimbursements and use up all the money that you need available there. And this is only for the retired member. Okay, so if you're dependent, for your dependents premium or copays, you can't submit to get reimbursed for their stuff. It's only for the retired member. Okay. All right. What's the next slide here? Oh, again, the carriers on the individual side, they require both Medicare Parts A and Parts B. Okay, so you can't just have Part B only like you can here with us on our KIPSA plan. Okay, and it's done through a phone interview. So you just call the phone number, you'll be connected to a representative. Now that representative may need to go ahead and set you up an appointment to talk to a benefit advisor who's actually licensed to enroll you into a plan. Okay, so sometimes the members will call and they'll actually get a benefits advisor from the first shot, and so they'll be able to go ahead and assist you. Otherwise, you'll get scheduled for an appointment, interview appointment, and then they'll be able to get you all signed up for a plan. Again, most Medicare Advantage plans do have the Part D, which is prescription built into it. Medigap supplement plans are medical only. So when you contact via benefits and you sign up for one of those, they're also going to need to sign you up for a prescription drug plan. Okay. Again, the plans are nationwide, and the benefits advisor will go over all the plans that's in your area. Although if you're going for a supplemental plan, it's nationwide, so it doesn't matter where you reside. Those are nationwide anyway. Okay. Again, when you're talking to them, you can also set up auto pay and direct deposit. So for example, you're paying the carrier that you sign up for. Okay. So you're paying them. And then what happens is that carrier reports to via benefits, hey, we received the premium in this amount from such and such and such and such person. then via benefits can automatically go ahead and do auto pay if the carrier is set up for it. Okay, they can do auto pay and automatically reimburse you back what you pay for your premium, and they can mail you a check, or they could do direct deposit. I recommend direct deposit because there's so many um, postal thieves that's going into people's mailboxes. So you don't want to get the possible check stolen out of your mailbox and so forth. Plus, it's faster if it's direct deposit. Boom, it goes right back into your account. Okay. So other thing is, if it is a check that you're waiting for, mind you, bad weather's coming. They say it's supposed to be a dark winter this winter, so I can see where there's going to be a lot of snow and ice and so forth. So if the carriers can't get to the mailbox to give you the check, that means you're not getting the check. Okay, so direct deposit, I would say, is the way to go. Okay, reimbursements for the current plan year must be claimed by March 31st the following year. Okay, so for example, we put money into this health reimbursement account for you to get reimbursed. Okay, so that's for this current year. Okay, so come December 31st, whatever balance you have will get wiped out to zero. And come January 1st, you start with your new amount for the new 2024 year. Okay, so now let's say it's now coming into January. Now we're in February, and all of a sudden you get this bill, or that you took care of, or you take care of it for service that you had in November or December because the doctor's office was late in sending you out the bill. Okay, well, you had those services in 2023. It's now February 2024. Well, get the claim form, get that bill that you paid, and submit that in the via benefits, because you have until March 31st of 2024 for any things that you had out of pocket that could still be reimbursed that was done in 2023. Okay, so you still have a little window there, because there are times where doctors' offices may get behind, in getting things out to you, and you may not be able to pay for those right away, and so you still need to be able to have time to submit those items. And as long as you had funds still available during the 2023, you can still submit, for reimbursements out of that stuff for 2023 services out of the 2023 funds all the way to March 31st. Okay. Again, they also have online health reimbursement tracking and status updates. So with via benefits, once you get in, you can go ahead and set up your login, and you can check the status of your reimbursement. You can check the account, see how much money do I still have in there that I can get reimbursed for, all that stuff. So it's pretty good, valuable resources over there. Okay.
And there's a question: what is the definition of a dependent?
Well, a dependent, it'd be whoever you have covered on the plan with you. Your spouse, your domestic partner, child. And you're the retiree member who's on the plan. So if you have someone enrolled with you, that's a dependent.
All right.
Okay. Hey, via benefits Medicare plans. Okay, so there are many plans available through the plan carriers over there. The premiums and costs, they do vary. It all depends on the plan and the level of coverage that you select. Okay, so for the most part, they are much lower than what the group plans are. Okay, so for example, the average quoted monthly premiums for Medicare Advantage plan with prescription drug coverage is $59.78. Okay, it was currently $59.78 was the average quoted price for a Medicare Advantage plan. Okay, for a supplemental plan, the average was about $142.41. Okay, and then of course that's just medical, so you got to get a prescription plan. So that was Part D plan. $25.20 was the average cost of a prescription drug plan. So as you can see, if you went that route, that's that's almost almost $178. Okay, for a nationwide plan and a prescription coverage. So, all right. Okay, so via benefits examples of plans that our members have enrolled into over there, because they're enrolled in all kinds of different plans. Okay, so these are a list of some of the plans that they're enrolled in. As you can see, they got ARP. Okay, again, insured by United Healthcare. Okay, Anthem Blue Cross, Blue Shield, Medicare Advantage Plan, United Healthcare, Blue Shield of California, Humana, Regency Blue Shield, Cigna, Blue Cross, Blue Shield Texas, Aetna, and then over in drug coverage, you got WellCare, Aetna, Medicare RX, ART Part D, Humana, Cigna, Anthem Blue Cross, Mutual of Omaha. So there's various different plans that you can select. And when you're talking with the representative to get you enrolled, they will go over what's available in your area, and they'll be able to probably, okay, well, this one, if you went with this one is this much is the premium compared to this one. This one's this much premium. The copay is this one. This one has this copay. You get to figure it out and say, okay, yeah, I'll go with this one. That one's better in my budget and so forth. And as far as the prescription plans, that they're really good with that because they have a prescription profiler. And see, is there a next slide on? Next slide about the prescription profiler, Mike? Yes. Okay, so and our members, once they get into a plan, they're pretty much usually set. They're pretty good with it. It's the ones that go into a Medigap or supplemental plan that they, and I encourage them every October, because as you know, pharmaceutical companies are always creating new medications. And things are always shifting from tier 1 to tier 2 to tier 3 or whatever the case may be. And so that changes the cost of that medication. Okay. So every year I tell members, hey, come October, contact Via Benefits and have them run your prescriptions through the profiler to see if there's any prescription drug coverages that would be better coverage for them on their prescriptions. And they do that, which is good because you may go in and see that, hey, your current prescription drug coverage is better right now than what's being offered there. Okay, cool. Then I'll stay where I'm at. I don't have anything to do with open enrollment. Or you may have them run your prescription stuff, and you may find that there's a prescription coverage that will charge you less copays for your prescriptions. Okay, let's go. Make that change. Let's go. So, you always want to check in because, like I said, these pharmaceutical companies, big pharma, there's always creating and developing new stuff, and they're changing things from one tier to another. So you never know where your prescription is going to fall, But if there's a way to pay less for your prescriptions, why not, right? It's totally up to you. You don't have to do that. If you're set, good to go where you are, good to go where you are. But at least you have the options to check in and see if there's anything better for you that'll save you some money. Okay. All right. So again, switching plans, medical plans. If you're enrolling in a plan with Via Benefits, you want to submit the medical plan enrollment form to Acera to cancel your Acera medical coverage. Okay. And the form can be found on our website right there. Okay. Fill any prescriptions prior to terminating your coverage is highly recommended. After your coverage has started with the new plan, contact your new PCP and tell them about any prescriptions that you're currently taking, making sure that everything's all set, that they can give you your new prescriptions from that that particular MD script so that the pharmacy can go ahead and continue giving your meds. Any dependents who want to remain on the previous plan need to contact Acera for COBRA options. So for example, let's say you and your dependent, okay, are on an Acera plan, whether it's Kaiser or United Healthcare, and you decide that because the retiree is the primary anchor, okay, if the retiree member is not on the plan, the dependents can't stay on the plan, okay, so they would lose coverage. So for example, let's say using a United Healthcare sample, member becomes Medicare eligible and they have a dependent on the plan with United Healthcare with them. A member needs to get off that plan and transition to a Medicare plan. So if they're either going to jump over to Kaiser Senior Advantage, they can pull their dependent over and they will be on Medicare plan Kaiser and the dependent will be on regular HMO Kaiser. Or if the member says, I don't want to go to Kaiser, I'll stay with United Healthcare plan through Medicare. So they contact Via Benefits. Via Benefits helps them to find a United Healthcare Medicare plan. Good, they're enrolled on that Medicare plan. Now the dependent can either transition over and go and see what Via Benefits can see what can find for them, or they can elect to stay on the current United Healthcare plan with us. However, it's going to be on a COBRA plan with us on that same plan, okay, which is only good for 36 months. Okay, COBRA is only good for 36 months. So the same thing if the person is on Kaiser. If you're on Kaiser and you say, okay, I'm getting my Medicare, I'm going to go find something else through via benefits. Okay, so now the member has left the Kaiser plan and gone to via benefits. The dependent can either go with them over there to find a plan, or they can opt to stay on the Kaiser plan with us, but as a COBRA member, which means it's not going to come out of your deduction for your monthly benefit. That COBRA premium is to be paid monthly directly to Acera for your dependents coverage for COBRA. Okay, so there are some options there. All right. All right. So again, switching plans and or enrollment into Medicare does not affect your dental and vision plan. So people, they call it, oh, what about my dental? No, dental, vision, medical, they're totally separate. Okay. You become Medicare eligible. That's a medical item. So you need to make an option choice regarding your medical plan. Your dental and vision remain the same just as they are. Okay. Mike, do you have the chart for the costs, the new MMA stuff?
Yeah, you want to see the new MMA numbers?
It's actually let's continue. I got a chart coming up. It's okay.
Okay. There is a question. Are there
Yes.
any fitness benefits with VIA benefits?
But via benefits, they only take care of you getting you enrolled into a medical plan. Okay. So if there's any fitness benefits, that you would have to inquire with the medical coverage carrier that you sign up for. Most carriers will have some kind of wellness plan. Okay. So because their whole idea is, well, we don't want to have to get you to be sick or injured, and then you're running up a high medical bill that's going to cost us to have to pay a lot of services. So we want to try and keep you healthy. So here's what we offer. So most carriers will offer some kind of wellness plan. So once you enroll into a medical plan, you want to check in with that carrier to find out, okay, what kind of wellness items do you offer? Okay.
All right.
All right. All right. Again, let's take a look at this. All right. So annual open enrollment. Okay. So, as you know, we are right now in open enrollment. Okay. This happens every year. You can change if you need to. If you're not looking to make any change, you don't have to. The only time you actually have to make a change is if your carrier sent you a letter saying, hey, you're going to have to make a change because we're not going to offer this plan that you're on next year. So then, of course, you have to make a change because you can make a change for dental, medical, and vision. You can add or remove dependents, cancel medical, dental, vision. Retirees with 10 or more years of service must remain enrolled in the dental and vision plans as coverage is subsidized by Acera. So if you have more than 10 years of service, okay, Acera's paying the subsidy towards your cost for them to be on the dental and the vision. So it's not costing you anything. So those who have less than 10 years of service, and so the cost for the dental and vision is actually coming out of your pocket, you can choose to stop being enrolled if you like. But for those who are over 10 years of service that we're paying for the coverage completely, if you don't want to use it, okay, don't use it. It's still going to be there and we're paying for it. It's part of our contract agreement with Delta and VSP to be able to provide a lower premium as long as we have all of our members who have 10 or more years of service enrolled. So we're paying for it. So it's not costing you anything of that. Again, our open enrollment is the entire month of November. The elections made during open enrollment become effective February 1st. Now, via benefits on the individual side, there's a little bit different. Okay, so their open enrollment began October 15th and runs through December 7th. Okay, with the elections that you choose there becoming effective January 1st, because they run on the individual side, it's on the calendar year, January through December. On Acera's benefit year, it's February through January. Okay, so again, your monthly retirement benefit amount must be sufficient enough to cover the cost of the premium. Okay, so for example, if you're only getting $800 a month as retirement, and you're trying to choose to be on the Kaiser HMO, which in the current year for 2024, well, the current year right now it's 909. Well, you can't sign up for that because you don't have enough money for us to deduct it. Okay, it's different if you're already on the plan and the premium increases, and then and it's above what you're getting, then we can see what we can work out. But if you don't have enough to cover the premium on from the get, you can't enroll into that plan because the system won't allow it. Okay. All right. Next slide. Okay. So here are the MMA amounts for the new benefit year. So as you can see at the top, okay, this is the non-Medicare and the pre-65 HRAs. In 2023, a 20 plus year member would get 616.12 subsidy. Okay. The 2024, that amount is increasing to 635.37. Okay. And again, the 15 to 19, 462.09, it's going up to 476. And then 10 to just under 15, from 308, it's going up to 317. Okay. Now, on the individual side, okay, if you have Medicare, if you're over 65, okay, then through the HRA for VIA benefits, 20 plus years, 471.99 is what they were getting monthly towards their in their HRA account. That's going up to 486.74. 15 to 19, 353. That's going up to 365. 10 to just under 15, from 236, that's going to 243. And I know some people say, well, wait a second. Well, if I got 20 years of service and I've been getting this $600 a monthly stipend from Acera to go towards my medical, how come now that I get my Medicare is I'm dropping down to this 400 something dollar figure? Well, that's on the individual side through the HRA. And the reason for that is because the premiums for the plans on the individual side under Medicare, as I showed you earlier, are extremely low. Okay. And a Medicare Advantage plan, they're averaging $59. That's a lot lower than the $316 that our KIPSA group plan costs. And then the supplemental plan was $129, and then what, another $25 for a prescription plan. So you're still paying a lot less for your medical plan. A vast majority, because we do run the reports and so forth, and we have to report this to the board. So a vast majority of members who are on Medicare through VIA benefits never use up all the money that that we put into the health reimbursement account. There's always money left over. Okay, very few, and I could probably count them on one hand, members who use up all the money that we put into their health reimbursement account for them to use. And those are, I can't give too much detail or violate anybody's HIPAA, but those are usually members who have a very serious ailment and they're on specialized compound medications by their doctor, which are very expensive. And so they tend to run out of their health reimbursement funding. Usually around October or November, they run out because those medications are very expensive. But otherwise, a vast majority of members who go through VIA benefits that are on Medicare never use all the funds that we put into the health reimbursement accounts. Okay. All right. All right. Qualifying events. Okay. Well, loss of coverage, relocating out of the service area, annual open enrollment, becoming Medicare eligible, retirement, marriage, and new domestic partnership. Okay. Those are qualifying events to make a change. Okay. Now, if you're moving out of the service area of your plan, okay, you got to make sure you got to, if you find some place you like to go to, you find that nice little cottage house, you want to go relocate, okay, always check in to see that it's still in the service area of your carrier, so you're not losing medical coverage. We got people who will find a nice spot, they love it, they buy it, they move, and then it's not too much later that they, when they actually need a medical coverage, that they find out, oh, what do you mean my coverage is terminated? You're out of the service area. So again, it's critical that you check the coverage area for if you are trying to relocate. Okay, you can reach out to Acera for assistance in this matter. You must complete an Acera address change form to update your record. Okay, only a signed change form will be accepted. No phone calls or emails. You can't call us and say, hey, I relocated, I'm over here in Las Vegas or whatever the case is. Okay, you gotta sign the form, complete the form and sign it. Okay. I mean, yeah, you can complete the form and then attach it to an email and send it to us, but you got to sign the form and get us a copy. Okay. Retirees who reside outside of California may not be required to pay California state taxes. So you want to make, that's another thing you want to keep in mind. So you can, you know, submit the tax forms so we can stop taking California state taxes if you relocate out of California. And then, of course, remember to send us Sarah a completed Sarah Address change form request, which can be found on our website at www.acera.org/forms. And you can quickly, complete the forms there. It's fillable, Mike. Is it a DocuSign or is it just a PDF? Do you remember?
Oh, which one?
The address forms
Oh, that one's DocuSign.
is DocuSign. There
Yep.
you go. See, so you can log in even from your phone and just complete it online, boop, and get it done. Submit it in. Piece of cake. All right. All right. Again, you can email questions to us at info@acera.org. Sarah is always ready to assist you. Thank you for viewing and have a great day. Are there any other questions that anybody may have?